I'm in Nanjing, China, with Kirstie Galbraith from the Postgraduate Studies and Professional Development Unit at Monash University, where 13 pharmacy workforce development goals have just been released by FIP. 5 of these are all about professional development, which includes advanced and specialist development. Ms. Galbraith, you are co-chairing a workshop on educating for advanced practice. What does advanced practice mean?
Thanks, Whitley. In Australia, we have a nationally agreed definition of advanced practice, so I was going to share that because I think it's helpful, even though it's not a globally agreed definition. But in Australia, we say advanced practice is practice that is so significantly different from that achieved at initial registration that it warrants recognition by professional peers and the public of the expertise of the practitioner and the education, training and experience from which that capability was derived. It's a little bit wordy, but it does help to explain advanced practice. And one of the things that we're hoping to achieve in the workshop tomorrow is to get some agreement globally about the difference between advanced practice and specialty practice. There's a lot of confusion amongst people about what those different terms mean, and it will be a great outcome from the workshop if we can get some common understanding of what that terminology means, and then we can use that to move forward.
Workforce Development Goal number 4 calls on countries to have training infrastructure in place to recognize advancement of the pharmaceutical workforce. Why is this important?
So there are 2 parts to that question, really, Whitley. The training is important and the recognition of the advancement is also important, but they can be considered separately. The training is particularly important, and we believe that needs-based training for all pharmacists and pharmacy students. So opportunities from year 1 pharmacy students right through to the most advanced practitioners, which is individualised to their needs and the journey that they're taking towards more advanced practice. It's also linked to the Workforce Development Goal 2, which talks about foundation training. So we consider this a journey from undergraduate students through foundation training and onto advanced practice. The recognition obviously is also important, but the lack of formal recognition shouldn't be seen as a barrier to people engaging in this journey. And all of us can be on a pathway through to more advanced practice, even in the absence of a formal recognition program.
What are the potential indicators of this goal? Is the systematic use of professional recognition programs? How might this work?
Again, the absence of a formal recognition program is not a deal breaker for people who want to engage in this journey. But eventually it will be fantastic if we do have formal recognition programs in place. There are good examples globally of how that might work, and part of our workshop will be looking to share some of that expertise around countries that have got successful recognition programs or are considering implementing successful recognition programs. But even at an individual level, individuals can be recognised. There can be local professional organisation recognition, and that can go right through to national recognition, and hopefully one day we will have global recognition of more advanced practice, with FIP leading the way on developing such a structure.
Thank you. This is Whitley Yee reporting from FIP.